The final study was conducted by Kim et al. In 2016 in the United States, and the purpose of the study was to test the effectiveness of a community-based, culturally tailored behavioral intervention program in a Korean minority group with type 2 diabetes and on metabolic and self-care measures. So the population was a total of 250 participants, and the setting was a Korean resource center. The intervention included a group-based education program of structured behavioral education, which their program was entitled SHIP DM. The sessions were 2 hours once a week for 6 weeks and discussed diabetes knowledge, coping strategies, and self-care, treatment, and risk factors. This education was provided by registered nurses and community health workers. This was compared to the control group who received brief educational brochures that highlighted self-management principles of diabetes management. The outcomes, the blood serum measurements, were taken at baseline, 3, 6, 9, and 12 months, so over a 12-month study period. And the authors found that there was a reduction of hemoglobin A1C greater than those in the control group, and that the mean changes between the groups for hemoglobin A1C and fasting plasma glucose were significant at 3, 6, 9, and 12 months. You can see in the table, if you take a closer look at the exact significance level of the measures at each of those time periods. The authors revealed that from their research they found that group-based diabetes programs are effective in improving hemoglobin A1C and fasting plasma glucose in the ethnic minority group with type 2 diabetes over a 12-month period, and that significant reductions were noted in both the intervention and control groups. However, the magnitude of the differences or the reductions in hemoglobin A1C were greater than those seen in other clinical trials. To summarize the clinical outcome results, the focus was hemoglobin A1C and fasting plasma glucose. Hemoglobin A1C was measured in all 4 studies, but reductions were significant in 2 studies, one conducted at 12 weeks and the other with a study period of 12 months. One thing that I would like to highlight is that in the 12-month study, which we just reviewed, the significant mean difference between the intervention and control group was significant at the designated time intervals of 3, 6, and 9, and 12 months. The significant difference in mean value of hemoglobin A1C was found in one study, and this was in the study that the final result of the hemoglobin A1C was not significantly different at the end. However, the value was significantly lower compared to the control group. In regards to fasting plasma glucose, this was studied in 2 of the trials, and reductions were seen in both of those trials, the one at 12 weeks and then the other conducted at the 12-month study period. The specifics of those results of those studies are listed here and are significant, as you can see the p-value indicated there. For the non-clinical results, the elements that were reviewed in this systematic review pertain to the session and program length of the group programs, the provider type, the topic focus, and the presence of follow-ups. In regards to session and program length, most often the studies included educational sessions of an hour or greater, and the program lengths varied, with the 50% of the studies utilizing the 12-month study period. Provider type also varied. The study, one study used registered nurses, one used community health workers, and two of the studies incorporated multidisciplinary teams, one with a dietitian and a nurse, and the other with a nurse and a health worker. The topic focus, since there are so many various important elements to consider when providing diabetes education, this was varied. However, there were themes across the studies: self-care, medication and insulin, self-monitoring of blood glucose, diet, lifestyle, complications of diabetes, and diabetes knowledge. The majority of these topics were used by at least two of the studies reviewed in this systematic analysis. Follow-ups was also an element that was assessed in this review, and two of the studies used the telephone follow-up calls, and one study used in-person follow-ups in the form of additional review of the self-monitoring of the blood glucose, as well as individual counseling for diet. The overall conclusion of this study was that group-based education for at least 12 weeks is effective in improving fasting plasma glucose levels, and it is also effective in improving hemoglobin A1C. Highlighted elements to consider when developing group-based programs include the program and education session length, the provider type, curriculum, and the presence of follow-ups. Although each of the studies reviewed provided were of positive quality, the evidence grade for this review is fair because there is still room for additional research to develop concrete guidelines and recommendations when developing group-based programs. As far as the conclusions, the strengths of this systematic review were the use of randomized control trials, which are all of positive quality, and that blinding was used in the trials, although it was single blinding, and that these trials used answered the research question. Limitations of this systematic review include the small sample size in regards to the amount of studies used to analyze the research, and the small overall total population sample size provided by the 4 studies. Because diabetes is prevalent across the United States and the globe, a sample size of nearly 1,500 people is not sufficient to provide concrete guidelines for a greater population, and therefore the results of this study are not generalizable to the nationwide or global population. Additionally, a limitation is that this review excluded non-face-to-face methods of group programs. It is highly likely that the adult population is a busy population, and therefore they may not have time to attend hour to 2 hour sessions on a weekly basis. Therefore, group sessions that are virtual and flexible with timing should be considered for an additional study. Additionally, the short-term nature of this study with the maximum study period length of 1 year is not sufficient to provide conclusions or projections for a lifetime or lifestyle, because 1 year is an insignificant time period compared to the entire lifespan of a human being. Despite the limitations, there are implications for practice from this systematic review. This review had the goal of determining the elements of effective group-based programs, and the elements to consider when developing programs include the setting, curriculum, program length, and session length, duration, and provider type. And these elements again should be considered when developing effective programs for diabetes management education. And it is also important to adapt the program to the target population in order to meet the needs of that specific people group. There are also implications for future research, and further investigation through clinical trials of group-based education is necessary and should be compared to individual settings in order to provide effective results through a cost-effective and wider range of manner. And there are also implications for research to explore the effects of group-based education in face-to-face and virtual formats. As I mentioned, that the virtual option provides increased flexibility to those who have busy lifestyles. The learning objectives again. After this presentation, you should now be able to compare various forms of group-based diabetes management programs, examine the literature for qualities of effective diabetes management group-based programs, and then determine the elements to consider when developing educational programs for this population. Here are my references. And thank you very much for your time. It was an honor to present at the FANCY conference, and now we will have time for questions.